Here's a healthcare turf war that's about to get messy. Malaysia's top medical body just threw down the gauntlet against a government cost of living council that's apparently trying to play doctor. The Malaysian Medical Association has fired back hard against the National Action Council on Cost of Living, known as Naccol, for what they're calling blatant interference in medical regulation. But here's where it gets controversial. This isn't just about bureaucratic boundaries. It's about who gets to decide how your healthcare is managed and priced. On August 7, 2025, MMA President Dr. Kalwinder Singh Kaira didn't mince words when he declared that Naccol has absolutely no business meddling in healthcare services. His main beef? The council's recent push for itemized billing and mandatory prescriptions at private clinics, requirements that the Medical Association insists are already being handled just fine, thank you very much. But wait, let's break this down for those unfamiliar with Malaysia's healthcare bureaucracy. Naccol was created specifically to tackle the rising cost of living that's squeezing Malaysian families. Think of them as the government's answer to expensive groceries, housing costs, and daily necessities. So why are they suddenly concerned with what happens in your doctor's office? Dr. Kalwinder's argument is straightforward, but loaded with implications. Naccol operates outside the realm of medical practice and the established medical laws designed to protect patients while maintaining standards for safe and effective healthcare. Translation: stay in your lane. Here's what most people don't realize. The Medical Association claims these so-called new requirements aren't actually new at all. According to Dr. Kalwinder, private clinics already practice itemized billing under the Private Healthcare Facilities Services Act, 1998. Meanwhile, prescription guidelines are supposedly already covered under the Poisons Act, 1952, and the Guidelines for Good Dispensing Practice. So if that's true, what's Naccol really trying to accomplish here? The plot thickened yesterday when Deputy Domestic Trade and Cost of Living Minister Fuzia Saleh announced to Parliament that Naccol had made several key healthcare decisions, including those mandatory itemized bills and prescriptions for every single patient consultation. And this is the part most people miss. This announcement suggests a level of authority that the medical community clearly doesn't recognize. Dr. Kalwinder's response was swift and uncompromising. He demanded that the health ministry step up and firmly safeguard the integrity and autonomy of the medical profession against what he characterized as inappropriate interference from non-medical legislation and other government departments. But here's where the controversy really heats up. The MMA president emphasized that healthcare regulation and governance must remain strictly under the health ministry's jurisdiction, without any interference or overreach from non-medical acts or other ministries. This sounds reasonable enough, but it raises a provocative question. Should cost of living concerns trump medical autonomy when patients are struggling with healthcare expenses? The Medical Association isn't just playing defense, though. Dr. Kalwinder highlighted a frustration that's been simmering for over 3 decades, the complete lack of action on revising consultation fees for general practitioners. Get this, these fees haven't been updated in 34 years. Let that sink in for a moment. While everything else has gotten more expensive, GP consultation fees have remained frozen in time since the early 1990s. This isn't just about money, according to Dr. Kalwinder. Despite the MMA repeatedly raising this issue with Naccol, the health ministry, and various levels of government, there's been zero definitive action. He's calling for this matter to be addressed with the urgency and seriousness it deserves, arguing that the sustainability of primary care services by GP frustration is palpable. This issue should not continue to be pushed around for repeated reviews and studies without any concrete decision. But here's the million-dollar question. If consultation fees are indeed outdated, wouldn't updating them make healthcare more expensive for patients? Isn't that exactly what a cost of living council should be concerned about? Adding another layer to this bureaucratic drama, recent reports revealed that the cabinet has urged the health ministry to fine-tune its proposal for consultation fee increases and continue stakeholder discussions. So while the MMA is pushing back against Naccol's involvement, the government is still trying to navigate the tricky balance between fair compensation for medical professionals and affordable healthcare for citizens. This entire situation exposes a fascinating tension in Malaysia's healthcare system. On one side, you have medical professionals arguing for autonomy and fair compensation after decades of stagnant fees. On the other, you have a cost of living council presumably trying to ensure healthcare remains accessible to ordinary Malaysians who are already struggling financially. So here's what I want to know. Is this really about protecting medical standards? Or is it about protecting medical profits? Should a cost of living council have any say in healthcare pricing, even if it might help struggling families? And most importantly, who should ultimately decide these policies? Medical experts who understand the complexities of healthcare, or economic advisors who understand the realities of household budgets? What's your take on this jurisdictional showdown? Do you think the Medical Association is right to push back against Naccol's involvement? Or should healthcare pricing be fair game for cost of living regulators? Sound off in the comments. This debate is far from over, and your voice matters in shaping how Malaysia's healthcare future unfolds.